Hi, my name is Dr. Jason Glotzbach. I'm a cardiac and aortic surgeon and co-director of the multidisciplinary aortic disease program at the University of Utah. Today I'd like to go through a couple of the basics of thoracic aortic aneurysm disease, explain what that is and what it means for you. So the aorta is the largest artery in our body. It comes straight off the heart and supplies branches to all parts of the body, all the organs and tissues of the body. And every heartbeat, the aorta takes the full brunt of our blood pressure and therefore is under a lot of mechanical stress. And so the aorta is a complex tubular structure. It has a thick wall that has muscle and elastic fibers in it that allow it to expand and contract with each heartbeat. And so an aortic aneurysm is simply a dilation of the aortic wall. And we term, the official definition of an aneurysm is when a blood vessel reaches 1.5 times its normal diameter. So the normal diameter of the aorta is about 2 to 3 centimeters, which is a little bit larger than a typical garden hose. And so once the aorta gets to 4 to 4.5 centimeters or larger, we term that an aortic aneurysm. And this is important because as the aorta grows, as an aneurysm grows, the tension on the wall goes up, and the wall tension is related to the thickness of the wall. Like when you blow up a balloon, the wall gets thinner and thinner until eventually the balloon pops. Obviously, if that happens with the aorta, we call that aortic rupture, and that's a devastating complication. And so the treatment of aneurysm is related to this risk, and we attempt to reduce the risk by fixing an aneurysm before it gets to that point, so to prevent complications like aortic dissection or aortic rupture. So the way we think about aneurysms is in terms of the anatomy of the aorta. So the aorta, if you think about, this is the heart down here, sorry, my marker, the aorta comes up and goes around the arch like this. So we make different anatomic distinctions of the areas of the aorta. So this first part, when it comes off the heart, is called the aortic root. And this is important because the coronary arteries come off here. These are the arteries that supply the muscle of the heart with blood. As the aorta goes up in the chest, this is called the ascending. Comes up and around, kind of like a candy cane. This is the aortic arch up here. Important branches coming off the arch go to the carotid arteries, go to the brain and to your arms. And then coming down creatively, we call this the descending. And then eventually the aorta passes the diaphragm down here and becomes the abdominal aorta, which gives branches off to all the abdominal organs. So aneurysms can affect any part of the aorta, and the treatment will depend on which part of the aorta is affected. So if the aortic root is enlarged, the aortic root is a very complex structure. It includes the aortic valve, which sits right there, and that valve lets blood out of the heart and then closes so that blood doesn't leak back into the heart. So an aneurysm of the aortic root can pull that aortic valve apart and cause a leaking valve, which can cause heart failure and other problems. The aortic root aneurysms are often related to genetic syndromes or connective tissue disorders such as Marfan disease, Ehlers-Danlos, and the like. The ascending aorta and aortic arch can also be aneurysmal, can have an aneurysm. And if those are affected, then often the root is not. So what causes an aortic aneurysm? There are several risk factors, including hypertension or high blood pressure, smoking, and even family history or genetics play a role. The way that we approach aortic disease here at the University of Utah is through a multidisciplinary approach with cardiac and aortic surgeons and vascular surgeons, as well as geneticists and cardiologists. The main treatments for aortic aneurysm include medical therapy, which can include blood pressure medications, and then surgery. And surgery typically will be either open surgery through either the front of the chest through a sternotomy incision, like open heart surgery, or other parts of the aorta we use endovascular or stent graft treatments to treat an aneurysm. And this inevitably is complex and determined by each individual patient's situation, which is why we approach all patients as a group and decide how to best treat each individual who may have an aneurysm. For us, the important thing is understanding the aneurysm disease is a chronic, lifelong condition that requires management and surveillance and sometimes treatment and intervention. And that's what we have here at the University of Utah. We're set up to do that. So if we can help with more information, please contact us with the numbers below, and we would be happy to discuss this further.